Swayam Prabha. Digital India. Educated India.
Today we will look at what is pathology, and we will address this topic, first attempting a definition of pathology. Then we will be looking at what goes into the making of pathology, that is, we will look at the subdivisions of pathology. We will also look at the important terms that we commonly use in pathology. So, these are the three areas we are going to look at, and let us start off with the first, that is the definition. What do we understand by the word pathology? Pathology comes from pathos, that is suffering. When one is not at ease, he or she has a disease, and the study of disease is pathology. So, logos means study of and pathos means disease. So, the study of suffering, the study of disease, when one is not at ease, that is disease, and that is what we study. Now, this is a very broad definition, but more specifically when we look at pathology, it is a scientific approach to the study of disease. And what does that mean? Scientific approach means what? It means structural changes. What structural changes can happen in organs when it is diseased? When organs are diseased, what are those structural changes that happen? So, that is part of pathology, and a large part of pathology will be looking at those changes that happen in the anatomy and the physiology. That is, the anatomy gone wrong, the physiology gone wrong is pathology. So, when we look at structural changes, we are looking at changes that have become so abnormal that it is recognizable as something pathological. So, structural changes are studied in pathology. We also look at functional changes. This is what I said, physiology going wrong. So, when the function becomes dysfunction, then that is pathology. So, anatomy going wrong, structural changes, physiology going wrong, functional changes. Investigations. An integral part of a pathologist's functioning is investigation. You investigate and find out what is wrong, so that you provide the final diagnosis. I will be talking about that in a moment. So, investigations are integral to the functioning of a pathologist. We will also be looking at causes and effects of disease. So, pathology not only will look at the changes that happen in diseases, not only look at investigations, but it will also look at what are the causes and what is the impact of these causes on the organs, and that is the effects of disease. It will be appropriate for us to remember that there is a book which was very popular many years ago, Arthur Haley's The Final Diagnosis. If you have read this book, it really explains to you the role of a pathologist in a hospital. So, as a beginning, I just thought I will introduce you to a storybook that will tell you the role of a pathologist in a hospital. What are the common terms? We will go to the terms and then we will come to the major subdivisions. What are the terms that we commonly use in pathology? The first term that we use is etiology. The word etiology in British English is written with an A, A-E-T-I-O. The American spelling for it is just E-T-I-O. Both are acceptable. One can write either depending on one's preference, but the word etiology simply means the cause of a disease. So, tuberculosis is caused by Mycobacterium tuberculosis. So, Mycobacterium tuberculosis is the etiology of the disease called tuberculosis. So, etiology is a big word to indicate the cause. So, for every disease we have a cause. We may not be able to recognize all the causes, but the word etiology is commonly used in pathology to indicate cause. The second term that is commonly used in pathology is pathogenesis. Genesis means evolution, the evolution of the pathologic process, the progression from the initial stages to the later stages is pathogenesis. So, the mechanism of disease progression is pathogenesis. Any disease, it does not just happen overnight, it happens over a period of time. It starts slowly, then progresses, and this initiation, the development and progression, all that is captured in this term pathogenesis. So, in simple words, it is the evolution of a disease from its beginning, its progress and to its complications. So, that is pathogenesis. The third term that we must be familiar with is morphology. Now, morphology means structural abnormality. I mentioned to you that anatomy going wrong is pathology. So, there are some changes that happen in an organ as a result of the pathologic process, and those structural changes are referred to as morphological changes, structural changes, and these structural changes could be at the gross level, that is naked eye appearance. So, structural abnormalities or morphological changes could be at gross level or it could be at microscopic level. So, morphology, when we talk of morphology, we look at two aspects. One is the gross changes and the other is the microscopic changes, and that is so integral to the functioning of a histopathologist. I will talk about that a little while later. So, morphology simply refers to structural changes, and these structural changes could be at gross level naked eye appearance, and at microscopic level, that is generally under the microscope. Another term that is often, very often used in pathology is the word lesion. Lesion. A lesion refers to a specific area which has become abnormal. So, we refer to that structural abnormality as a lesion. For example, the area that is affected by tuberculosis in the lung, we can call that as the lesion. So, the affected area, the abnormal area in an organ, the focus which is the area which has undergone some pathologic change, that is called lesion. So, lesion in its simplest definition can be seen as that area which is abnormal structurally or functionally. So, that is a lesion. So, it is a focus, it is the area that is become abnormal and can be visible and can be detected by the pathologist or anybody investigating. So, the lesion is something which can be part of a major organ. One focus can be affected, we call that the lesion. The lesion is here. So, when we look at a organ and then we say the lesion is here, we are specifically referring to the area which has become abnormal in terms of its anatomy. The next term that we must be very familiar with is something which you might have already heard, and that is diagnosis. Diagnosis simply means the act of naming a disease. When you have a person, you name the person. When you have a disease, you name that disease. Naming of a disease, the christening of a disease is diagnosis. So, diagnosis basically is the name you give to a disease after you have examined a patient. The word diagnosis simply refers to the act of naming a disease. So, ultimately we give a diagnosis after you look at the symptoms, the signs, the manifestations, the laboratory findings, you arrive at a diagnosis. So, diagnosis is that final judgment, your opinion that you give at the end of assessment of a patient. A clinical examination of a patient will usually end with your final diagnosis, and that is why that book which I mentioned to you is appropriately called the final diagnosis, and that will be apparent to you when you read the book. So, the word diagnosis, very frequently used word in pathology, and for that matter in medicine itself. In the practice of medicine, you will be using this word almost every other opportunity you get to talk about patient's illness, you will talk about diagnosis. The other word that is of importance and of significance is prognosis. Prognosis simply means forecast, the prediction. The first thing the patient may want to know, the family members will want to know is what is the future, what is the forecast, particularly with reference to cancer. When a diagnosis of cancer is made, we often talk of 5-year survival rate. So, naturally the patient as well as the family would like to know about the forecast, and that prediction based on the experience that we have, we are able to predict, and that is prognosis. So, basically prognostication, forecast, prediction is prognosis. Any disease, especially malignant conditions, especially cancers, we often talk of prognosis, and that prognosis is generally in terms of 5-year survival rates. We generally do not go beyond that, we talk of 5-year survival rate. So, we say 90% survival rate 5 years. So, that is an indication of the future, that is the prediction. So, it is necessary because any disease when you diagnose, you have to as an obligation let the family members as well as the patient know what it entails, and Therefore, prognosis is a word that you will also be using very, very frequently. These are two words which you encounter, which you have used, but you should know the difference. Symptom is what the patient complains. When the patient comes and tells you that I have pain here, I have nausea, these are symptoms. Signs are what you observe as a physician, as a doctor. When you observe, your observation gives you the signs. So, you examine a patient, you can elicit signs. So, signs are what you elicit or you observe. Symptoms will be what the patient tells you. Now, it may so happen some of these manifestations can be both symptoms and signs. A patient vomiting and you see that patient vomiting, then of course, it becomes a symptom and a sign. The next term that you will encounter in medicine, not just in pathology, you are going to hear about this word syndrome. Syndrome is a collection of symptoms and signs. Cushing's syndrome. When you hear the word syndrome, it means there are certain signs and symptoms, together they constitute a disease. So, syndrome, a large number of syndromes are well known and you will be using this over and over again. Basically, remember, a syndrome will be a collection of symptoms and signs, maybe 2 symptoms, 3 signs or 2 signs, 4 symptoms, whatever, sometimes just 1 symptom and 1 sign, but they are quite characteristic and make that disease nameable. You are able to give a particular condition a name because there are certain symptoms and signs, and there are so many syndromes. I think medicine is full of so many, replete with so many syndromes. Another word that you will encounter, a term that you will often encounter, is eponym. Eponym simply means named after a person or a place. Philadelphia chromosome, Reed Sternberg cell, Addison's disease. Whenever a name is associated with a disease or a symptom or a sign or a laboratory finding, we use the word eponym. So, eponym simply means named after. So, it could be a place, it could be a person, Hodgkin's disease. So, all these indicate that a person's name or a place name is associated with that particular manifestation or disease or symptom or sign. So, it could be anything, but essentially the word eponym is used when we link it. In fact, sometimes certain diseases are better known because of their eponymous nature. Burkitt's lymphoma, Hodgkin's disease, these are perhaps better known than the actual disease name itself. Berger's disease, well known as Berger's, better known as Berger's instead of thromboangiitis obliterans. So, what I am trying to tell you is that the word eponym is very useful sometimes when we talk about certain diseases in the presence of the patient. It is better not to cause concern in the patient. Suppose you were to say the patient is having leprosy. In the presence of the patient will probably feel terrified. Instead of that, when you are talking amongst yourselves as professionals, it is better to say this patient probably has Hansen's disease. So, when you say Hansen's disease, the patient may not understand, but you as professionals understand that you are probably dealing with leprosy. So, that is the usefulness of having eponyms. If you want to talk about a particular possibility of a particular disease, existing, you could do so without alarming the patient, and therefore eponyms are very, very helpful. The other word that is of frequent use in pathology is pathognomonic. Please note this word, pathognomonic. Pathognomonic means it is so very characteristic that it indicates the disease, it gives you the diagnosis. I say this because many diseases can be diagnosed based on that particular specific finding which is unique. For example, when we talk about Reed-Sternberg cell, there is we say Reed-Sternberg cell is pathognomonic of Hodgkin's That means what? If under the microscope you are able to see this Reed-Sternberg cell, you are absolutely sure that the disease is Hodgkin's disease. Similarly, there is a chromosome called Philadelphia chromosome. If one were to identify Philadelphia chromosome, you are sure that the patient has got chronic myeloid leukemia. In other words, it is a confirmation, it is pathognomonic of chronic myeloid leukemia. So, the word pathognomonic is to be used only in those situations where that symptom, sign or laboratory finding is specific and unique to that particular condition. So, it has to be used very carefully, cannot be used just because it could be a characteristic finding, it does not make it absolutely unique to that condition. So, the word pathognomonic must be reserved for those situations where that particular finding is very unique to that particular disease. So, that is pathognomonic. The word autopsy and post-mortem are synonymous. Autopsy means I see myself. You open a body, cut open a body and see yourself, that is why autopsy, auto, self. Post-mortem obviously means immediately, that is after death you examine. This is commonly done as a procedure for audit purposes as well as to find out why a patient has died. Sometimes you do not know why the patient has died. To investigate that, you would often do a post-mortem. You should also be aware of certain other terms in pathology. The words primary and secondary are to be understood in the right context. Primary means we do not know the cause. Primary hypertension means the cause of the increased blood pressure is unknown, that is primary. It is sometimes called idiopathic, essential, that means it is a cause unknown to us. There might be a cause, but we do not know. So, when we do not know the cause, we say it is primary. Secondary means the cause is known. That hypertension, if it is caused by kidney disease, then we say that it is secondary hypertension, secondary to renal disease. So, that is one application, one context in which the two words primary and secondary are used. Primary and secondary also used in the context of neoplasms. When we talk about malignant tumors, when we talk about cancers, we say primary cancer and secondary. Primary means the focus where it is in its original location. Secondary means metastasis, it has spread to a different location. When the tumor has broken off or been carried in circulation or in lymphatics and carried and taken to another part of the body, that deposit is sometimes called secondary deposit. It is same as metastasis, that means it has got located elsewhere. So, the primary tumor and the secondary tumor. So, this word primary and secondary, there are two contexts in which it is used. One is indicating the cause that is not known, and if the cause is known, it is called secondary. That is one usage. The other usage is in the context of neoplasms, in the context of cancers, primary tumor and secondary tumor. We often use the words acute and chronic. Acute means sudden onset. Acute appendicitis, suddenly it announces itself and it happens suddenly, and then of course it may have a variable course. Chronic means very insidious, very slow, very silent, and generally it has a longer duration. So, when we say a disease is chronic, it is over several months, sometimes several years. Acute, usually the duration is much shorter, but more important with acute is the suddenness of onset. That is what makes acute different from chronic. Chronic, generally it is silent, very insidious is a nice word often used in pathology to indicate slow, silent, without announcing. It makes its beginning and then it progresses over a period of time. So, acute is sudden onset, generally short duration. Chronic is silent onset, generally long duration. We often use these two words benign and malignant in the context of tumors again. Benign tumor is harmless tumor, malignant tumor is tumors which can cause harm. One of the first concerns for any patient is when a tumor is diagnosed, the first question that will be asked of a doctor is it benign or malignant? Benign means that will not cause you harm, there is no risk, there is no danger to life, whereas malignant means it can have consequences, it can have detrimental effect, it can cause damage and it can have consequences and it can affect the longevity of the person. So, benign means harmless, malignant means harmful. I mean, that is a simple way of looking at it. When we look at diseases, we are also looking at the life of a disease which can have ups and downs. A disease does not have to be of the same intensity at all times. There will be times when the disease will be quiet, the symptoms and signs will be less, that is called remission. Remission means the quiet period in a disease. Relapse means the re-emergence of the symptoms and signs. Recrudescence, the re-emergence, all the symptoms and signs flare up again, that is relapse. So, diseases generally do not have the same level of intensity. There will be times when the disease will be quiet, there will be times when the disease will have a flaring up. So, remission is the quiet, the quiescent phase as it is called, and relapse is the flared up phase. Any disease has this, typically it is known with ulcerative colitis, you will hear about that later. Crohn's disease, there are many diseases which have ups and downs, and this up and down process in a disease is referred to as remission, that is for the down part of it, and relapse for the up part of it. Now, we come to very quickly the subdivisions. The major subdivision in pathology, the first major division is histopathology, surgical pathology or anatomical pathology, where diagnosis is based on tissue study. You remove a piece of tissue, biopsy, you do a biopsy, remove a piece of tissue, study that tissue under the microscope, and you pronounce the verdict, the final diagnosis. That branch of pathology is called histopathology. Generally, that requires the use of a microscope. Of course, this is just to show you the association of the microscope with the pathologist. Today of course, we have more modern versions of these microscopes, but the essence of histopathology is tissue sent by the surgeon. The surgeon removes the tissue, maybe in the theatre or in the outpatient, and sends it to the pathologist. The pathologist examines the tissue and gives small pieces for study, and this is generally sent in formaldehyde, 10% formaldehyde, so that the tissue is preserved, the tissue does not decay. So, generally the tissue is sent by the surgeon in formalin, and a few other preservatives are used, but ideally most of the time it is sent in 10% formalin, and that tissue is finally processed, and you see it on a slide which is stained, and this is what a biopsy slide looks like. Very often when a biopsy is done, this is the biopsy slide which is looked at by the pathologist, and the final diagnosis is given. So, the diagnosis of course cannot be made just on a microscopic study, it requires consultation. You consult with your colleagues, professional colleagues, you have to have a clinico-pathological correlation, you may have to correlate with the radiological findings, and finally the report comes. So, this is the final report, the final diagnosis, which is a legal document on the basis of which treatment is given. So, it is something that has to be given tremendous importance, and the histopathologist's report is considered to be the final diagnosis for the commencement of a treatment, whatever the physician or the surgeon wishes to do. Sometimes an urgent diagnosis is required, and that is when the patient is on the operating table under anesthesia and a quick diagnosis is required. They do what is known as a frozen section. Here some of the steps in processing of tissue will be bypassed. The tissue is frozen, studied, and a quick diagnosis is given. Based on that diagnosis, the surgeon decides the type of surgery that is needed. This is just to show you a frozen section that has been done, and based on this the decision to decide for a major surgery or just to remove the lump is taken. Autopsy or post-mortem, I mentioned about this earlier, is also part of a pathologist's functioning, and it is done generally to find out the cause of death. Please remember, this has nothing to do with forensic autopsy, that is to find out in cases of where medico legal issues are involved, that is different. This is primarily to find out the cause of death, and for research autopsy always helps. When you look at cells alone, cells individually studied will be cytopathology. This is the second major branch of pathology. You see the cluster of cancer cells, and this is often diagnosed by what is known as many countries have Pap Smear as a requirement for women. Every 2 years they have to do this, primarily to prevent cancer of the uterine cervix. This shows you a cluster of cancer cells. It is a cytology preparation referred to as Pap Smear. Pap comes from the word Papanikolo, George Nicholas Papanikolo. Papanikolo is a Greek name, but for convenience and for brevity we use the word Pap Smear. Pap Smear is done, and it is a cytological process. So, of course, so many variations are there now, but basically remember that is the second branch of pathology. The third branch of pathology deals with blood diseases, leukemias, anemias, all these are part of hematology. So, we look at blood cells. Hematology has now become an independent branch. It has actually meandered away from pathology. So, hematologists consider themselves as totally independent now. Then of course, there are a few other branches of pathology which once upon a time used to be under pathology, but today they have all become independent. Chemical pathology, which is actually diagnostic biochemistry. forensic pathology, which is a totally different branch now, medical jurisprudence as it is called, blood banking has become independent, immunology has become independent, and genetics has also become independent. So, this gives you an overview what is pathology. We have looked at the terms, common terms that are used, the subdivisions, and of course, most important it is for us to remember that pathology is the study of dis-ease, suffering. Thank you.